This slide is showing us the abdominal pelvic regions as well. However, what is most commonly used in medicine is utilizing the quadrants. So you'll need to know the 9 abdominal pelvic regions that were on the last video, but also the 4 abdominal pelvic quadrants on this video. So the 4 different quadrants are the right upper quadrant, often abbreviated as RUQ, the left upper quadrant, abbreviated as LUQ, and then inferior to that would be the right lower quadrant, which is RLQ, and left lower quadrant, which is LLQ. And you want to make sure that you remember that, again, you're looking at your patient or you're looking at your specimen that you are dissecting, and your right is their left is your right. So let's look at that example of the 4 abdominal pelvic quadrants. So in the right upper quadrant, as you can see here, we have the large majority of the liver. There's still some liver on the left upper quadrant, but we also have the gallbladder found in the right upper quadrant. The gallbladder is often seen just posterior to the right lobe of the liver. You can see a little bit of the gallbladder, the most inferior portion of it, that is sticking just below the liver. Also found in the right upper quadrant is some of the stomach, as well as a portion of the large intestine, as well as some of the small intestine. And at this point, you don't need to know the regions of the small intestine or the large intestine. So we can see the bulk of the liver. There's still some liver that's in the left upper quadrant, a little bit of the stomach, large intestine, gallbladder, and some of the small intestine. In the left upper quadrant, this is where we see the large majority of the stomach, large intestine. The spleen is located over here as well, but you can't really see it that well. The spleen is going to be located a little bit up here in this region, a little more superior. So in addition to the large intestine, we also have a little bit of the small intestine. So what's important is that you can identify these organs and you know them in relationship to the quadrants. For the right lower quadrant, we have predominantly the small intestine. We also have the large intestine. There's a little bit of the pelvic cavity as well, because after all, this is the abdominal pelvic cavity. It's not been separated into the abdominal cavity and the pelvic cavity. So there's a little bit of the urinary bladder there. And we pretty much have the same thing for the left lower quadrant as well. We see the small intestine, part of the large intestine, and then portion of the urinary bladder as well.